All right, so first and foremost, all of you, I would presume, are Cigna members then? Yeah, okay, wouldn't make much sense to be here if you weren't. Who in the room here has actually logged in or created a username and password on myCigna.com? Got a few? Okay. So as a Cigna member, in all honesty, I think that this is the best tool for you to not only help you understand your benefits. If you happen to have to find a new provider, let's say you don't have a primary care physician, your primary care physician retires, or you need to find a specialist, this tool is actually going to help you find the providers that not only provide the best quality of care, but whose costs may be a little bit lower or more in line with the marketplace. So again, to not only help yourself save money, but to help save Colorado College money, this is going to be a great tool for you to do just that. All you need to do to log in is go to just www.mycigna.com. From there will be a Register Now button. All you need from there is it'll ask you for some information. You'll either need your medical ID number or your Social Security number, either way. And then, like every other website in this world, it's going to ask you to create a username, password, those type of things. The unique thing about this benefit, the one that I'm using today is a demo, so we don't show any personal health information. But what's unique about our website is your benefit is actually going to be loaded into the system. And it's going to take into account what your deductible is, how much you've actually met of your deductible, or your out-of-pocket maximum. So if you're actually going out there to research, all right, I'm told that I'm going to need a surgery this year, and you really want to understand what your total true out-of-pocket liability may be, this tool is going to help you find those resources. So what I'm going to do today is I'm just going to walk you through some of the tabs here to get you a little bit more comfortable with this tool, how to find a doctor, how to really look for those doctors and facilities that outperform their peers, and then I'll also show you how to access all of the health and wellness resources that are available to you, so you can increase your chances of getting that pretty sweet into your price. So to get started here, I'm gonna mostly work through this top ribbon here. Everything that you'd really need to find, for the most part, will be in this top ribbon. So if you ever just have any general questions, concerns about your health coverage, you just come to this Review My Coverage tab, and you could select medical, we'll say here, if you have questions about your medical plan. It's going to show you exactly who's covered. Again, here, this is a demo site, so it's all generic information, but also show you who's covered. And then you can continue to go down here. What your plan features are, like your plan, your deductible, what those out-of-pocket maximums mean. And for those of you that may not be familiar, your out-of-pocket maximum, that's your yearly liability, if you will. That's the absolute maximum that you would have to pay in a coverage year. And then down below here, it'll actually start walking you through some of the services here. So like preventive care. What that coverage is going to look like, your office visits, what that coverage may look like, for going to a primary care physician or a specialist. Again, this is going to be specific to your plan, not just this generic information. So if you ever have questions, concerns, you can always use this as a resource. All right. One other piece that I want to touch on here, we'll start here, is this deductibles and your maximums tracker. Again, if you're having what I would call a pretty bad plan year, and maybe you've had some accidents, and you've almost hit your deductible, or you've almost even hit this plan out-of-pocket maximum here, which again is the most that you would have to pay in a plan year. After that, everything's going to be covered at 100%. So if you're approaching that, you can use this tool to keep an eye on that. Say, all right, this next visit, things are going to be covered at 100%. Then you know that everything moving forward, there's no liability to you. So again, just a good tool there for you. Another piece that I like is this discounts. I'm not going to go into there because it'll take me to a whole nother site. but this is something that we call healthy rewards. So this is just a resource for you to access things at a discount that may be outside of your traditional coverage. We've partnered with a number of different gyms. A lot of the initiation fees with gyms may be waived just by being a Cigna member. Sometimes the memberships can be cheaper. Weight loss facilities like a Jenny Craig, Weight Watchers, those type of facilities, or things that are outside of traditional medicine. We've also created some discounts with companies. Not to say that all of them are going to be here, but this is just if you're looking to do something else, you can search that database to see if you can get a discount. All you got to do is show them your Cigna ID card. So just another tool for you. All right, moving up here to manage claims and balances. So anytime you have a claim and you want to track that claim, this is where you would want to go. All I would do is just click on this claims tab here, and you can see if the claim is still pending. So if it hasn't been paid yet, you can see if the claim has been paid. If for some reason a claim has been denied, you can also see that here. If a claim has been denied, first step that I would do is call Cigna. Call that number on the back of your ID card, or 1-800-CIGNA24 will always get you to the right place. And just talk to them first. Our Cigna's model is a first call resolution. At the end of the day, you're still calling a customer service number. That's our model. It doesn't always happen that way, but that is what we're striving for. If you don't feel like your call has been addressed appropriately, or you've gotten the answers that you need in one call or one call only, get with your benefits folks. We have a dedicated resource on our team to help fight or help you understand those tricky claims questions. A lot of times when a claim is denied, it's just because we didn't get the appropriate information. And we just may need to either ask you for some more information or the provider for some more information. But don't feel like you ever have to fight those by yourself. I understand. I work in it every day, and it's over my head at times. So by all means, get with your benefits folks to help you with those. No claims are in here again, since this is a demo, but that's where you would go for here. I would also suggest, I don't know, for all of you can turn on your explanation of benefits. You can have those still mailed to your house if you're getting them and you don't want them mailed to your house. I know I personally don't want my personal health information coming in the mail. You can turn those off just up in this profile section here. But again, if you ever receive a bill from a hospital or a doctor, always make sure that you come and check your explanation of benefits first. And the reason that I say that is if you receive a bill from a doctor and that bill is much higher than what it should have been, and Cigna has already paid that doctor, I promise getting your money back is a very miserable, hard thing to do. So again, I always, when I get a bill, check my explanation of benefits. If those match, I know I'm in good shape, I can go ahead and pay. If they don't match, I'm going to call Cigna, I'm going to call the doctor, and I'm going to get that figured out. Again, I would start by calling us. We're your resource to help you. And we can reach out to those doctors for you if you would like. And then just help understand exactly what's going on. But again, always check those explanation of benefits before you ever pay.
And I may have missed this, but this is just, didn't we move over to this summer? Is this just moving forward now with this fiscal year, the 2015-16 year? So the earlier ones wouldn't show up?
No. They stay in here. If you see here within, I can filter back. You know.
Okay, so it would go to last year.
Yeah, you can go back to last year. Yeah, they're. Okay. Let's see. I've been with Cigna for almost 3 years now. I can see all of mine.
So it's just, even though I think
the
platform changed, but okay.
Yep.
That's good.
No, and so this myCigna.com has been around for a few years now. So.
Okay.
So we did change from the Great West platform
Right.
to the Cigna.
So that's been almost 2 years now, I think.
So they'll just hold the ones from the Cigna platform, not the prior Great West, right?
Probably yes. It would have had those ones from. I think they from a platform change they'll save those for 18 months. But yeah, last year everything should absolutely be on there. All right. Any other questions before I move move forward. The next piece that I'm going to go to here is this find a doctor or facility piece. This, in my opinion, is the most important piece here. So if you pay attention to anything, I would suggest this one. All right. So I'm going to I'm just going to show you a few searches here. Again, we're going to start with a primary care physician search first. If you need, I would certainly recommend if you don't have a primary care physician to look into that, as the penalties for not having health insurance continue to go up. I certainly expect the marketplace to be flooded, and finding a primary care physician is not going to be an easy thing probably here in the next few years. So if you don't have one, I'd certainly suggest doing so. So we'll make this a more reasonable search here. Just going to actually go here. So I'm just going to type in PCP. Again, one of the things that I really like about this site is if you are looking for a doctor and they show up on this site, rest assured that doctor's in network. I think most people are pretty comfortable now with the idea of in network versus out of network. By staying in network, you're going to save yourself a lot of heartache. If you go out of network, there's a number of different things that that can happen. You can be charged quite a bit more for going out of network since we don't have those contract agreements in place. But again, this site will help you be sure that you are in network. The second piece that I want to bring to your attention is I talked about this Cigna care designation. So what and the beauty about this site again is you can see it's sorted by Cigna care designations first. So those doctors that are outperforming their peers, they're going to rise to the very, very top. And the way that Cigna identifies these doctors, or the way a doctor gets this Cigna care designation, is that number one, they have to be board certified. Number two, they also have to be practicing evidence-based medicine. So I'll just use an example for you. So if someone is a diabetic, they should be taking a blood pressure medication. They may or may not have high blood pressure, but that blood pressure medication will help protect their kidneys. So if a doctor isn't prescribing those medications as they should, that would be an indication to us that they are not following evidence-based medicine. If we're, again, to that diabetic standpoint, if we're seeing an indication that individual isn't getting their eyes examined or their feet examined every so often, or they're not getting their A1C or their blood sugars tested as often as they should, as evidence-based medicine suggests, then those doctors may not get that Cigna care designation. And the other thing about this is that we just draw a line in the sand. It's just the top 30% of contracted doctors get listed as a Cigna care designated doctor. Just because your doctor's not listed in there doesn't mean that your doctor may not be a very, very quality doctor. You know, they may fall just below that 30% line. Or if we do not have enough information from your doctor yet, we're not going to rate somebody until we have enough claims come through to adequately rate them. So again, looking for a primary care physician or a specialist, you can find these Cigna care designations. So again, if you're looking for a new one, I'd look for that symbol. Then you know you're getting a doctor that's practicing a little bit differently. All right, now I'm gonna walk you through just a few searches here, so you can understand how our cost and quality tool works. So we just touched on quality there, finding a quality doctor. Now I'm going to help you make wise decisions based on cost. So let's say you have an accident and you're going to need a knee surgery. So you can just click over. If you guys didn't see here, I just if you follow my cursor, I just went to procedure, and this tool is pretty good about allowing you to not have to type in medical terms. By just typing knee surgery, I was able to find knee arthroscopy. All right, so what I've done here is I found, again, in-network doctors with the Cigna care designation, and then you can see the total estimated cost. All right, so this total estimated cost here first, this is what you would pay plus what your plan sponsor, or in this case, Colorado College, would pay. In this case, this plan is showing that you owe the total estimated cost because this is what we call a health reimbursement account where they haven't met any of their deductible yet. But again, if you have a copay for going, or Lori, maybe you can. What would a NISA, or is it a deductible then?
That would be a
Deductible
So
first.
50 deductible, and then if they're in network, 15%.
Okay, and then so then you would be responsible for 15%. So it would have that 750 plus 15% would be what you would owe. It would show that here. But then you still have to keep in mind this total estimated cost. Because if everybody goes and runs wild and goes to the most expensive providers that don't offer great quality, rest assured that at some point, then Colorado College has to make a hard change to say maybe your premiums go up. So everybody has a role in keeping the total cost down. So as I just continue to scroll here, it may take me a while. You got a lot of Cigna Care designated doctors here, which is good. So as you can see, well, it just jumped up to $8,000 for the same procedure. So that tells the story itself. Would anybody like me to search any other basic procedures? I'm going to do a big one that would be more of an inpatient stay.
Birth of a child.
Yeah, that's where I was going next. Maybe. All right, so much like we've gone and evaluated individual providers, we've also evaluated the hospitals. As you can see here by the Center of Excellence. Cigna is not unique in identifying centers of excellence. All really major carriers are doing something like this today. I hear it on the radio quite a bit now. Facilities are now toting we've been recognized as a center of excellence. So you may hear this more and more. But again, same idea. As you can see here, there's this star rating that we have. This is just how we rate them. And in order to be a center of excellence, you have to get a minimum of 5 out of these total 6 stars here, based on cost, which is pretty straightforward, and patient outcomes. Again, patient outcomes meaning how often are there side effects when this specific procedure is done at that hospital? How often are people readmitted with this specific procedure done at this specific hospital? Now, just because Memorial or St. Francis does a really good job at delivering children, doesn't necessarily mean that they're going to be the best at a knee surgery or a hip surgery or a back surgery. So it's important that you check for each specific procedure because different facilities are really good at certain things. I'll use Skyridge. You guys familiar with Skyridge, just on the outskirts of Denver? They do more knee surgeries down there than any place in the country. They're really good at it. So they can charge a little bit less. But again, we almost had a child there. They don't do near as many deliveries there, and they cost way, way more. So just because they're great again at a knee surgery doesn't mean they're going to be great at something else. So again, pretty simple here. Once you know how to navigate this system, it's just going to help you make more educated choices for yourself to save yourself and everybody money at the end of the day. All right. I'm going to jump over here to home delivery. If you're taking a maintenance medication, as I like to call that, something we'll say like for blood pressure that you know you're going to be taking day after day after day after day, you really can save some money by using Cigna home delivery. So just something to consider. You can jump over to this site to try to get a new prescription. By going right here, you can track your prescriptions as you can see here, and you can order new prescriptions right from here if you need them, as long as your prescription is active. The easiest way, in my opinion, if you want to start Cigna home delivery, give customer service a call. What you're going to need is the medication that you're requesting, your doctor's information, and you're going to need a credit card on file for that. And then they'll reach out to your doctor and work it out for you. Again, just a way for you to save yourself a little bit of money since it's shipped in 90 days. Just that classic bulk mentality. You'll save some money there. It's the one. The easiest one would be the one on your back of your card, or just call 1-800-CIGNA-24. Either way, I'll get you there. The number on the back of your card is easiest. Yes.
So I've already gotten my prescription with Cigna
Uh-huh.
at the pharmacy, and it's more than it says it is on the website. How do I call to find out how I can lower that cost? Because when I put in that prescription on the website, it says I should only pay $6, but when I pick it up, I'm paying $40.
Is that? Yes, I would call customer service and ask and say, look, on your cost estimator tool, it's saying that it's $6. Look,
Okay.
can you please tell me what's going on? Yeah,
Thank you.
by all means, I would do that. And again, if you're not getting the answer that you want, let either one of these two ladies know, and we'll get in front of it for you.
Thank you.
Yep. So you are one step ahead of me. You figured out the cost estimator tool, it sounds like.
Yeah.
Great work. No, that's good. Again, I think this may be one of the more meaningful tools for everybody in the room. It'll just help you get an idea. If you're sitting in a doctor's office and you're told that you need to take a prescription, or if you just want to see if there's any lower cost alternatives out there for you, just to have a conversation with your doctor, this is where you're going to want to go here. So I went to the far right, estimate healthcare costs, and get drug costs here. Now they just updated this, so this may be interesting to see if I remember how to do this, because I haven't done it on the new one yet. What's the zip code down here?
80903.
80903. Okay, and I'm going to do a Lipitor, which is a cholesterol medication. Check a couple pharmacies here for us. Not often are the pharmacies all that different, but they can be. All right. So as you can see here, if you were to take the Lipitor a month, it would cost you $188 a month. If you even went home delivery, it'd be $169 a month, so little savings there. But if I look over here at Atorvastatin, that is literally the same exact ingredients as Lipitor. For this plan, you pay nothing. Again, Lori, what's your generics? So you would see 10 here when you looked it up in your plan.
So what do you do with that then?
So then you just have a conversation with your provider. First of all, you got to ask them if this generic. There's probably see more alternatives. I think there's 5 or 6 different alternatives. So you can have just an in-depth conversation with your provider.
Doctor say, hey, what's the generic thing going to be?
Yep.
And can you give me that stuff?
Absolutely. And doctors are really good about starting with generics now. But at times, especially if you're somebody that you try the generic and there's a side effect, it's going to help you have different conversations. Like, hey, what do you think about? Let's see, I'm thinking like simvastatin. Maybe we should try that one, just to have different conversations. And patents for drugs are ending all the time, so you can just check regularly to see if a cheaper alternative has come up if you're on a very expensive med. So yeah, again, just to help you change the conversation.
Can the pharmacist give you a generic if the doctor prescribed it?
Well, they'd have to call back
Oh.
to get that. No, they're not able just to change that. A lot of pharmacists will say, hey, do you know there's a much cheaper alternative available, and give you that information to arm you with. But yeah. All right, I'm going to quickly here, I just got a few more minutes, I'm going to jump over to a whole nother tab. So when you log in here, up at the very top, My Plans, that's for everything we just talked about. My Health. This is going to be your tab for all of your health and wellness resources. So number one, Lori talked about a couple incentives, taking your health assessment being one of them. It's very easy. It takes about 8 minutes. Rest assured, this health assessment is 100% confidential. The only thing that Lori will see, I promise you, is the date that you completed and, in fact, that you did complete this information. By law, we cannot give any of your information. We cannot change your health premiums by you filling something like this out. Pretty common question that I get, but just wanted to get ahead of it and let you know that by doing something like this, it's only, it's for a couple of reasons. Number one is to help you get a better understanding of your overall health. Number two, once you finish this, it'll provide you with a few resources that you can work on for your health. And then number three, as an entire organization, we can get all that information pulled together in one spot, and it'll help Lori and I determine, what are you guys looking for, or what are your needs as it relates to health and wellness. So kind of a three-pronged little approach there for doing that. So literally all you do, jump in here, click this Get Started tab, and you'll go ahead and walk you through to finish that. If you have additional questions or just want to see what else is out there for you, I'd recommend coming to this Programs and Resources tab. That tab is going to let you know every program that you have available to you. Not all these programs are for everyone, but you do have a really good menu option of resources that are available. If you're newly diagnosed with a chronic condition, asthma, diabetes, maybe heart disease, you have a program available to you to help you understand all that information as it comes flooding in. Not looking to change or take the place of your doctor by any means, but just I know for me, I'm an asthmatic, and when my asthma came back and was a little worse than when I was young, it helped me just frame my questions for my doctor, to ask different questions, and then I'd walk out of my doctor's office at times with a big treatment plan and really not understand what to do with it. So it gave me another resource to help me. So you have coaching available, you have online programs available. If you're just looking for a little extra accountability, maybe it's quitting tobacco, maybe it's stress management, or even weight management, something like that, you have tools here available for you. They're all free, so use them as you see fit. Also, another fun little tool that's been added. Our raffle today is a Fitbit. We're giving out 2 of these for being here today. So you can connect your Fitbit directly to myCigna, and then you can challenge your closest coworkers or friends if they're on Cigna as well to first to 70,000 steps wins, or you can even just challenge yourself. They're called pursuits. So I typically challenge myself through here to get 40,000 steps minimum a week. So just another resource to help keep me accountable, just to keep you moving and going here. Again, a free resource for you here. Let's see here. You don't have to have a Fitbit to participate in this. So if you just have a smartphone and you want to participate, you can connect up like a Map My Run, MyFitnessPal, those as well. Fitbit's just the easiest one in my opinion. So questions, concerns for me as I just hit the 30-minute mark.
How did you get to apps and activities?
So back on the My Health tab, this top banner up here, there's an Apps and Activities tab. You just have to agree to let the things sync up. Anything else? Otherwise, we'll figure out who's a winner. All right, let's do it to it.
Did everybody get a ticket?
Oh, or is it?
This is the one
I
I
know.
know.
Oh, you told me. I think the blue one. Oh, okay, great.
Should we get it?
Yeah, you can stop the recording.
Oh, yep.
I moved to go to myCigna.